Wisconsin and Minnesota are neighboring states and football rivals. Politicians also like to compare the two when it comes to big issues. PolitiFact Wisconsin puts one claim about health care costs in the governor's race to the Truthometer. Health care costs have dominated the political landscape this election year. The candidates are throwing out a lot of numbers that can be confusing to voters.
Tony Evers attacks Governor Walker. He says Wisconsin pays 50% more than Minnesota for the same health care.
PolitiFact Wisconsin says that's a pretty broad statement. Evers was referring to what it would cost an individual in Minnesota versus Wisconsin through the state and federal marketplaces under the Affordable Care Act.
The 50% is accurate for a narrow slice of the population. If you look at 40-year-olds who buy individual policies for themselves for health insurance, that 50% figure is correct.
But PolitiFact Wisconsin points out Walker's campaign cites higher costs in 2017 in Minnesota versus Wisconsin for employer-based annual family health insurance premiums.
But Evers' statement leaves out families, for example, who buy their own care, and it also leaves out the vast majority of people who get their health insurance through an employer or through the government, such as through Medicare.
So PolitiFact Wisconsin rated Evers' claim mostly false.